Hello friends, now we are going to discuss about understanding HIV and AIDS, moreover how this HIV and AIDS is throwing a global challenge. So we know something about HIV and what do we know basic aspect of AIDS. Now is it both are same that HIV and AIDS? No, HIV is the initial infection, AIDS is the manifestation of HIV infections. And this HIV and AIDS together are causing a global challenge. It's mainly because even though we have medications, even though we have developed some vaccinations in vaccination here and there in the world, but still now we could not get a comprehensive view. I mean, the comprehensive approach to clearly eradicate this disease. It's there everywhere. People are dying because of AIDS, and particularly underdeveloped countries where there is no proper public health system, so where there is no surveillance system. So in such a countries, it's a challenge. But when it is a challenge in some of the countries, it's a challenge of a globe also. So that's why we discuss in the scenario of global challenge. So we look at the overview of this HIV or AIDS. The human immune deficiency virus or HIV and acquired immune deficiency have emerged as one of the most significant public health challenges of the modern era. If you look at any other disease, which COVID, we could tackle it. But what about HIV? We couldn't. What about Ebola? We couldn't, because it's not because that we cannot have a medications or we cannot have a particular vaccine. It's mainly because the strategy this virus used to invade, I mean the evade our immune system is entirely different from the what strategies normal viruses, and they are potent viruses, and it won't cause any kind of symptoms in the beginning or the initial or the window period. But later suddenly humans develop some like syphilis or gonorrhea or maybe some multi-organ bacterial infections. Then only we'll come to know why his immune system is down. It's mainly because this HIV is infected CD4 cells, that is your basic cells which are required to activate whole system of immunity. And first identified in the early of 1980s, these conditions have since affected millions of people worldwide, leaving an indelible mark on both individual lives and global health systems. Because people are more, it's more of sexual transmitted, one of the sexual transmitted disease. So people are stigma associated with that. The society problem is there. The way we look at this disease is different from the disease we look at COVID. And this class is all about the origins, transmissions, impact, prevention, treatment of HIV, and highlighting what are the ongoing efforts what the global population is taking. Maybe a World Health Organization, or maybe CDC, or maybe NIH, how much project they are doing. So, I mean, across the globe, people are joining their hands to manage the disease. But still, even though we talk like that, it's the disease which we can manage, but it is still a challenge. What is the origin and transmissions? HIV, the virus responsible for causing AIDS, belong to the family of retrovirus. As we all know, it is a RNA virus, and it is believed to have originated from the simian immunodeficiency virus, or SIV, called, found in non-human primates in Central Africa. This was the idea. That means this HIV virus, people thinking that HIV virus might have evolved from this similar virus called simian immunodeficiency virus, and which was commonly there. You can find them in primates, but this is the idea. I mean, the initial spillover might have happened from Central Africa. It's mainly because the transmission of HIV to human is thought to have occurred through the hunting and consumption of bushmeat. That means traditionally the tribes of Africa, particularly most of them are tribal populations, and these tribal populations has got a traditional practice of hunting and eating meat. But when they hunt and eat meat, whether they cook and eat, that's the problem. And their blood, and the problem, possible way of contamination is the blood. And these HIV infections might have transferred. I mean, the spillover might have happened from this bushmeat into human beings. That's the one idea. And similarly, there was a detection of HIV even in homosexual population in USA also. So there is it's like still discussion is going on about the origin, exactly whether it came from Africa, I mean the primates to human, or if it is, we could not clearly establish. Lots of claims are there, claims and counterclaims are there about the origin, but still we could not establish properly. And but still there is an idea that it was first discovered in homosexuals. The two main types of HIVs, like HIV-1 and HIV-2, have a different origins. HIV being the more widely spread globally. So if you look at widespread global problem, that is HIV-1. Now, the HIV primarily spread through exchange of certain body fluids. That's why we call about stigmas. It's like whenever during COVID, if a particular person sneezes, we were afraid that sneeze can propel a large quantity of virus in the form of a small fluid or droplets, which could infect others. But the virus, I mean, the HIV is not like that. Unless a proper exchange of fluid happens, there is no chance of this viral spread. One is a blood. As we all know, if anything is there in the blood, it will easily enter other circulatory system if there any cut or something is there. Then second is a semen, then vaginal fluids, rectal fluids, and breast milks. So these are all the proper body fluid through which only this virus can, as we all know, virus is a living, non-living entity. So if you provide them a fluid and if you provide them a cell, survive. If you don't provide them a host, you don't survive. Same thing like that. This fluid will act as a connection between two hosts, a living bridge between two hosts. One host is infected, one host is free from infection. But if a host A X connect with host Y through these fluids, then it bridge a live connection between them and transmission happens. The most common modes of transmission include unprotected sexual intercourse, sharing contaminated needles among intravenous drug users, particular drug addicts, mother to child. This is the one more biggest challenge during childbirth or maybe during breastfeedings. Mother connections with the child so it can cross the placenta and enter human beings and start infecting at the early age. This is the challenging thing even in Africa, Americas, India, and while the virus cannot be transmitted through casual contact, understanding the mode of transmission is crucial for developing effective prevention strategies. And just holding a hand won't spread this disease, but will spread through this injection, syringes, and particularly these homosexuals or maybe people who are addicted. They see some addicts. The problem is they don't have money to buy a new needle. What they'll do? They use the used needles, and used needle will have a small droplets of blood or maybe blood contaminations. And if a particular person use the same needle, what happens? It spread from that addict to non. I mean another addict, and another addict to. So it's a mass spread. Same thing like breastfeed. If a mother is infected, then when mother feeds a child, the child will get infected. So this is the problem. So why people casual in a conjugal, and it's clearly established the casual contact won't spread this disease, but understanding the spreading of particular disease is necessary. A transmission mode is necessary because because it's not a vector borne disease. This is not a vector borne viral disease. It's a human to human transmission. And we need to understand this. Unless we understand this, we cannot have a strategies to prevent this. We need a proper strategies to prevent this disease. No, unless we have a strategies, we can't prevent. Unless we know how exactly things are going, in which fluid and all this virus can survive. So many aspects are essential. Now HIV virus. So we talked about this one. So mode of transmission and all these things. We were thinking about HIV is different, AIDS is different. If HIV is a unique system, so we will go into study its structure. Human immunodeficiency virus is a complex retrovirus. One thing is this virus is a retrovirus. Retrovirus means its genetic material is RNA and it has got an enzyme to make its own DNA by using enzyme called reverse transcriptase. That's a unique kind of enzyme through which you can make a unique DNA from RNA. The virus is composed of lipid envelope derived from the host cell membrane, structural proteins, enzymes, viral genome. Genome is the core energy source for this. The genome is the one which codes everything what is needed for the virus. And understanding the structure of HIV is crucial for developing strategy to target and inhibit its replication. Here is an overview of the basic structures in the 2 or 3 slides which we are going to discuss more about the structure. So why do we need to study the structures again? Things like you wanted to target the virus. Unless you know the structure, how can you target the structure? I mean the virus. What are the composition of a virus? What are the things are there? I mean, when you study virus in detail, we can find some loopholes in virus. Maybe there is no perfect thing in evolution. So everything and everywhere there is a loopholes, and we can target the loopholes are the critical point. Once you target that critical point, we can develop a drug or maybe vaccine or anything related to combat to, I mean, the fight with these infections. So first thing is lipid envelope. The outer layer of the HIV particle, we will look at the structure. I took the picture from NIH. Particle is a lipid envelope derived from the host cell membrane. During the process of budding, and embedded in the lipid layer envelope, viral glycoproteins are there, GP120 and GP41, which is very essential 120 because where exactly the key the lock fits, I mean the key and lock fits 120 play a crucial role in a virus ability to bind and enter the host. The binding is important. Unless it binds strongly, it cannot enter the host cell. So binding and enter the host cell scenario happens from these glycoproteins. As we are talking about TH cells, so this TH cell is important cellular machinery which are needed for our activation of whole system. If this GP120 with this virus enter, I mean the bind this and kills this CD4, CD cells, then there is no, I mean, sorry, TH cells, there is no cell to activate whole system. So what happens? Our immune system slowly start reduce its effects. And GP41, this glycoprotein anchor the viral envelope to the viral membrane and it is responsible for the fusion of viral and host cell membrane during the process of entry. Just binding is not done. It has to dissolve both membrane of a cell and membrane of a virus. So who is helping for that? GP41. So GP120 is a binding one and GP41 is helping the virus push inside. Then there is a one more protein called matrix P70 located beneath the viral envelope. The matrix protein provides structural support to the virions. That means virions means newly synthetic viral particles. So matrix protein is important. GP120 and GP41 is essentially important. Without that, this virus cannot do anything. So that's why they concentrate more on GP120. Is there anything can be done to reduce the effect of GP120 targeting them and all those things? Then there is a capsid P24. The capsid is a protein shell that we have seen in the picture that encloses the viral genome and it is composed of repeating units of the viral capsid protein P24. Once after, like it's like a beads after beads after beads and connected and form this capsid. The capsid protect the viral RNA and associated enzymes during the early stages of viral life cycle. So this capsid protein protect the viral RNA and associated enzymes during the early stage. So the work of capsid is to give a kind of protection, support to the inner material, that particularly viral genome. The viral genome, HIV has a single stranded positive sense RNA. This viral RNA carries the genetic information necessary for the production of new virus particles. Genome also contains genes that encode for essential viral protein, including structural protein GAG, enzyme pol, polymerase, and regulatory protein called ENV. GAG, pol, ENV are coded by this RNA. So that is important for this virus to survive. So that means a viral genome, maybe HIV genome, is providing everything what is essential for that virus to make virions spread to next cells. I mean, the continue its generations. The enzyme which involved here is reverse transcriptase. Reverse transcriptase is an enzyme that encoded by the pol gene. So where you can see the pol genes are there in the viral genome. It plays a crucial role in the replication of the virus by converting viral RNA to DNA and this process is unique to retrovirus. That means traditionally we say that DNA to RNA, RNA to protein. That is a strategy, central dogma. But in case of reverse transcriptase, it reverse. RNA to DNA, then DNA continual process. So it's unique. Then proteases. The protease is another viral enzyme encoded by the pol gene. It involved in the maturation of a virus by cleaving the precursor protein into functional individual proteins. Now, whenever anything produced in any organism, it will be in the inactive form or precursor form. Once you trimmed and fine-tuned, that will become active protein. So protease work is that. Then we have integrase. So what is the function of integrase? Integrase is also important protein. Integrase also encoded by the pol gene and facilitate the integration of viral DNA into the host cell genome. And this integration is a crucial steps in the establishment of persistent infections. So integrase also encoded by the pol gene and facilitate the integration of viral DNA into the host cell genome. And this integration is a crucial step in the establishment of a persistent infections. Now HIV life cycle, we'll see what really happens here. So if a person is had an unprotected sex or maybe blood transfusion, so what really happens? This viral particle will enter its blood circulatory system, and in the blood circulatory system there will be a moving TH cell or CD4 cells. CD4 cells are T helper cells which are needed to activate B cells, I mean the B cell, as well as TC cells or cytotoxic cells. And you know that this virus is a particle which specifically intracellular. That means it live inside the cell. So what is the idea is it is well protected because it is inside the cell. And the idea is when a virus is inside the cell, if unless cells show, I mean host cell shows some kind of morphological difference, our cytotoxic cells won't attack them and kill them. So that's when it is getting a proper hideouts compared to bacteria, because bacteria is a fluid. I mean it is extracellular particle, so it will be there in our fluid system. So easily the antibodies or maybe other T cells can attack them and kill them and neutralize them, kill them or neutralize them. But that is not easy in case of any viruses. So here, what is the first strategy this virus does? It attaches, binding of virus, that means attached to GP, to the receptors. Once it is bound, then that GP41 will help this one to dissolve. I mean the membrane will fuse and release its genetic material inside. Once the genetic material inside, it start making its next generations of materials. So that is with the help of reverse transcriptase. So reverse transcriptase will bind with RNA and transcribe, I mean convert RNA to DNA. And once the DNA is made, it replicates and then uh, again continue the process, make its genome. Once the genomes are ready, it assembles into virions or particles. Once virions are ready, they're packed properly, and I mean all quality check is done, and active things are released into the space, I mean next cell. So it continues the cycle. So attachment, binding, fusion, reverse transcription action, replication, assembly, budding. So these are all the different processes. And along with that, there is an integration process also. That means as attachment, fusion, reverse transcription, integration, replication, assembly, and budding. This is the whole cycle of this HIV infections from one cell. But this will continue with different cells. From because this virions will move to the adjacent cell unless the adjacent cells are resistant to this virus. We have an interferon in our system. Interferon will send an emergency warning to neighboring cells that there's a virus is coming from a neighboring cells. You try to avoid that, but it's not easy in all the cases because it has got a strategy to manage, evade that system. Then next we will move on to this one. So we looked at what are the transmission mode, then what is HIV, how the life cycle happens. Now when this multiply like this, what are the symptoms HIV we can see? Acquired immunodeficiency syndrome or AIDS is the advanced stage of HIV infections. Initially we don't see any, there is a window period. It is characterized by a severe weakening of immune system, making individuals susceptible to opportunistic infection and certain cancer. In most of the cases, what happens, if a particular person is got infected with HIV, he may not be knowing about it. Person X is not knowing about it. What happens if you just imagine after a few years he develops syphilis or maybe gonorrhea, some STD based disease, and he takes some antibiotic treatment. He won't cure, it won't get cured. The source will remain like that. Then doctors or maybe medical practitioners may get a doubt why this person's system is not developing, even though that particular bacteria is susceptible for the particular antibiotic. Why it's not cured? So then people check for other things. Then they'll find out yes, there's HIV infections. So his immune system is severely down. You kill with any antibiotics, but immune system should act on time. Then only we can manage this. The symptoms and clinical manifestation of the AIDS can vary widely among individuals, and the timeline for progression from HIV infection to AIDS also can differ. See, because this is all a specific cases. One individual to another individual, there will be a variation in conditions. It is important to note that not everyone living with HIV will progress to AIDS, especially with effective treatments. See, if a particular person came to know that he got infected and he takes early treatment, he won't move to AIDS. He'll stay in the HIV state, and slowly, with the help of medications, we can kill this virus. But it is not true in all the cases. If the immune system is weak, the viral load was very high, he went unnoticed for many months, then it's very difficult. In this slide, we'll look at symptoms. So first, what you call early HIV infections. Many individuals with HIV may not experience noticeable symptoms during the early stage of infections. This is critical. This is the window. We don't notice any symptoms. Some may have a flu-like symptoms, including fever, fatigue, swollen lymph nodes, sore throat, which typically occurs within a few weeks of exposures. Some may have a flu-like symptoms, including fever, fatigue, swollen lymph nodes, sore throat, which typically occurs within a few weeks of exposure. That's important. Some symptoms which are similar to a normal viral infection, so we can't see, because a normal flu infection also leads to a problems. Fatigue, common thing. But the chronic HIV infection or clinical latency, after the initial symptoms, the virus may enter a prolonged period of clinical latency, during which the virus continues to replicate at lower levels and individual may not experience over symptoms. That means it is it found out a proper hideout inside a human body, and they use all machineries of our system and start multiplying there. But it won't show any aggravated symptoms. HIV is still active and can be transmitted to others during this stage. This is the problem. Here, clinical latency stage, not much symptoms, and people may get contact, physical contact, through which it can transmit to others unknowingly. Individual receives ART, that is antiretroviral therapy, during this phase can suppress the virus and prevent or delay the progress to AIDS. So that means this is the critical stage, this clinical latency stage. If you take ART treatment during the time, what happens? You can suppress the viral multiplication. You can prevent or delay the progress to it. That means you will get a more time to reach AIDS stage from HIV stage. Then symptoms of AIDS. That means you could not do anything at HIV. That means you could not prevent at HIV stage, or you went unnoticed, and slowly you move from HIV stage to AIDS stage. If a person reached AIDS stage, what are the symptoms he observes? What we can see. So clinical symptoms. The diagnosis of AIDS is made when the immune system is severely compromised. That means its CD4 level is extremely low. So he is prone for opportunistic infections or certain type of specific cancer you can see only in case of AIDS patients. The common symptoms and clinical manifestations of AIDS include opportunistic infections. First one is pneumocystis girovascular pneumonia or severe lung infection of PCP. PCP infections are quite common in these patients. Then tuberculosis. Normally we are immune to tuberculosis, but if these persons are not, they'll keep on getting these infections in lungs. Cryptococcal meningitis, infection of the brain and spinal cord by this cryptococcus, bacterial infection. Because this bacteria is everywhere, this virus is everywhere. Now virus enter a body and suppress the immune system, and bacteria will be waiting for the system to get out. The bring down, so the bacteria can enter and make its infections. Then toxoplasmosis, an infection caused by Toxoplasma gondii parasite affecting the brain. Then cytomegalovirus retinitis, infection of the eye that can lead to blindness, CMV infection. Then candidiasis, a fungal infection that can affect various parts of the body such as mouth and esophagus, even genital part. So this candidiasis, because the candidiasis, in fact, if you take a medication can cure, but in this case it's impossible because your system is low. Whatever medication takes, it will be there for a few days, then again it reoccurs. Recurrence of a problem is the biggest challenge in case of AIDS. Problem recurs. So PCP problems, tuberculosis problems, cryptococcus meningitis problems, toxoplasmosis problems, cytomegalovirus problems, cytomegaloretinitis issues, then candidiasis issues. Next, then this people, there is a typical kind of cancer issues in these patients. One is called a Kaposi sarcoma, a cancer that causes lesions in the skin, mouth, and other organs. Then non-Hodgkin's lymphoma, a cancer that affects the lymphatic systems. So non-Hodgkin's cancer, a cancer that affects the lymphatic systems. That is another typical type of cancers. Kaposi sarcoma, a cancer that causes lesions in the skin, mouth, and other organs. Then wasting syndrome, a unintentional weight loss, chronic diarrhea, chronic weakness, often refers to as HIV wasting syndromes. Unintentional weight loss. You don't want to lose a weight, but slowly you lose a weight. Chronic diarrhea, simply all the time diarrhea. Chronic weakness, you feel weak all the time, lethargic, you can't do any work, you feel you're weak. But even though you don't notice it, that's called wasting syndrome. It's often referred to as HIV wasting symptoms. So this is all advanced stage. If you can prevent at HIV stage, you won't progress to AIDS stage. In the AIDS stage, all these things you can see. This topic is all about what is the complications. It's like if the HIV is advanced to AIDS, and from AIDS at the end, what are the problems we are going to face if we got infected. One more complications what is primarily faced by this high-end symptom, high-end HIV patients or high-degree HIV patients, that HIV-associated neurocognitive disorder called as HAND. Cognitive and motor abnormalities that can range from mild to severe. So that means neurological complications are also associated with these HIV infections. That is in the what you are calling in the advanced stages of HIV infections. Then peripheral neuropathy, damages to the peripheral nerves that can lead to numbness, tingling, and muscle weakness. Peripheral neuropathy means damage to the peripheral nerves that can lead to numbness, tingling, and muscle weakness. These are all the common problem neurological complications what HIV patients face. Now, next is other complications. What are the other complications they face? One is cardiovascular disease. Individual with HIV have an increased risk of heart disease. Individual with HIV have an increased risk of heart disease. You just see the connection between a viral infection, the heart problems. So this is really challenging for us because sometimes in our lifetime we may get infected with some problems. So this may create another issue on some of the organs. So this is the biggest challenge. Why some are getting problems, some are not getting problems. Mainly, maybe some infections are making that organ more prone for other infections or associated problems. I mean, post-infectious period, in many cases, this is the organ problems. Kidney disease, HIV-associated nephropathy can lead to kidney damages. HIV-associated nephropathy can lead to kidney damage. Liver disease, co-infection with hepatitis B or C may exacerbate liver problems. That means this HIV infection associated with other infections like hepatitis B or C can kill the liver. Same thing like that, it can also kill the kidney. So that means infection of one side, particularly HIV, can have a devastating effect on our body because it is going to create a problem for even our liver and kidney and heart, even nerves also. That means this is the associated problem with any viral infection, not with this, any viral infections. Now, what treatment strategies they develop? One treatment strategy, there's antiretroviral therapy is a one method to prevent and treat it. And ART not only enhances the quality of life for all those infected, but also significantly reduce the risk of transmission. That is an interesting thing. It won't give a kind of solution, but more than that, what is significantly reduce the risk of transmission. Transmission is the biggest challenge from a individual X to individual Y. This is moving. We should cut that. That means we should not provide a host. If the virus get a host also, that should not multiply in that one and make a vulnerable population more prone for infections. Additionally, pre-exposure prophylaxis, pre-PrEP we call, is a preventive measure for individual at a high risk of HIV, further expanding the toolkit for controlling the spread of virus. So pre-exposure prophylaxis is one more method they use to control this. So antiviral retrotherapy, there are many drugs which are used as a ART, which are mainly targeting the retrovirus, retrovirus by killing the enzymes involved in that one, particularly reverse transcriptase enzyme. If you kill this reverse transcriptase enzyme, the advantage is viral replication will stop. That is the target. No? We need to kill the virus. Once you kill the virus, there won't be any replications. So enzymes are killed means enzymes are primarily responsible for multiplications. If you kill the enzyme, then there is no multiplication. So that means you can end the infection. So that is the strategy. Now, what is the global impact of this HIV? That's what we were discussing. So, this is not from an Indian strategic, this is the global thing which I have taken from World Health Organization. The impact of HIV and AIDS is all felt at a global scale. It's not only maybe originated in Sub-Saharan Africa or Central Africa, being and particularly Sub-Saharan Africa being disproportionately affected. This is the challenging thing. In many countries, there is a report of AIDS, but they are under control. But what about these Sub-Saharan African countries? Many countries are there. According to UN AIDS, an estimated 38 million people were living with AIDS worldwide in 2019, and 6 lakh 90 people, 90,000 people died from AIDS-related illness. Because see, this is the one thing which is very difficult to keep a surveillance, particularly countries where the international agencies are not having any access. And this is, see, most of these kind of programs or eradication programs will be successful only when the international agencies join hands with the local agencies. If you work hands with hand, I mean the face with face, or with the target with the target, then only we can eradicate. But that's not possible in many countries because the traditional belief and their own country, most of them are ruled by dictators. So it's very difficult to access for international agencies. So whatever data we are presenting here, approximate data, and we don't have a proper data, particularly from India or maybe Africa or Americas. We don't have, particularly Latin America, we are talking. The socio-economic consequences are profound, affecting communities, families, and individuals. At a global level, just imagine one person in a family got AIDS. The whole people look at society, look at them in a different way. So stigma still is there because it's mainly people think the AIDS will come only through sexual activities. That means the particular person is having sexual activity outside the partner. That's not so good as for the society. So people look at disease from that point of view. That's not real. It can come from sharing, I mean, needles, right? So that's one. Or else you might have taken a blood might have infected with HIV, unless we test for that. There's a possibility. The loss of productivity and increased healthcare costs and the burden on healthcare system contribute to complex challenge posed by this pandemic. Now the thing is, just imagine we were concentrating more on AIDS and working for constructing hospitals or those for them. Simultaneously, other diseases are there. Who will treat them? Who will take care of them? So this is the challenge. Stigma and discrimination remain a significant barrier to effective HIV preventions and care. So if you want to prevent and care, the stigma is the biggest problem and discriminations. People living with HIV often face a prejudice, leading to isolation, hindering their access to healthcare services. Addressing this social aspect is crucial for creating an environment that encourages testing, treatment, and support for those. So once a person got infected, so they need to test. Testing means diagnosis. Diagnosis aids you can diagnose easily by using ELISA technique, by using antibody, colorful antibodies. You can diagnose them easily. Simple techniques are there. No need of targeting virus. Only the antibody which is produced against virus also can be specific and which can be used to target. So just a diagnose. And then the primary contact, trace the contacts and test in them. If they are not positive, then no problem. If they are positive, give them treatment at the early stage. Because if you give treatment at the early stage, advantages are high. But if a later stage, what happens is it spread to whole part of the body, and from there, if unknowingly, if another person also caught with the infection, so it's very difficult to break the chain. That's why in the initial stage only we need to break the chain. At the starting point, it's now the prevention strategies. As we look at the global these things, so what is the prevention strategies people looking for? I mean that implemented. Preventing the spread of HIV require a multifaceted approach that combines education, behavior intervention, and access to healthcare service. So one is we need to educate people, awareness, create awareness about this disease. Tell the people this is a disease. This disease will come like this, and be careful. And this disease, there is no proper cure. So the only supportive care can be given. So we need to educate the people. So that's very important. Unless we educate, it is very difficult for them to manage the disease. So education is a behavioral intervention. And like people should that the stigma problem should, I mean, people should get rid of the stigma associated with any disease, because we know we are living in a world where it's possible to develop technology for anything to treat. It's not that it's a Herculean task. Fund is there, money is there, so we can develop. Global people come together, join hand together. Then is a condom use. Practice safe injection techniques. Harm reduction program for intravenous drugs users. Essential component of prevention efforts. One is educate people about unsafe cells. So that's a challenge, particularly underdeveloped countries, African countries. The family system is weak. Because of that, what happens is they don't know the partner's histories. They go for sexual pleasure. So because of that, what happens? The people get infected. Then drug users. So we should educate them, drug users, the particularly that don't share the needles. If you share the needles, this is the problem what you face. And whether they listen to us or not, secondary, but educating them is necessary. It's a need of the hour. We can't escape from that. So we need to educate them. We need to tell them this is the problem you face, because when you face a problem, it is a problem what the society faces. You may act as a reservoir for that particular virus. So be careful. You don't be prejudiced about that, but better get a treatment at an early stage if you feel that you got infected or you're showing some symptoms. Voluntary counseling and testing. VCT play a crucial role in identifying, treating infections early, preventing further transmissions. So voluntarily, people should come out if they suspect that they got infected. So they should come out and they should get the testing done. So testing is important. Testing isolation is essential for any disease. And treatment. Testing, isolation, treatment. If we can follow this protocol properly, we can stop the spreading of disease at an early stage. And then we talk about the treatment and care. While there is no cure for HIV, as we all know, viral infection cannot be cured easily. We don't have a single shot solution for this, because this is a big problem. An advancement in medical research have led to the development of highly effective antiretroviral drugs. There are many drugs which can kill this virus, but not up to the mark. Whether it eradicate the whole virus from the body, we don't know exactly. And recently there was a vaccine developed where some people were got cured also. So great news. But what about numbers? Whether everyone will get the immunity against this? At what stage we need to get the injections? And the problem is here, we can't identify who is got infected in the initial stages. They don't show any symptoms. But as the disease progresses, symptoms start appearing. And we treat for normal infections in this case. Then it will get delayed again and again. By the partner might have got, maybe the children might have got, or other drug partners might have got, or maybe you might have went for blood donation. From there, it might have gone to many people. This medication works by suppressing the replication of virus, allowing, I mean, their antiretroviral drugs, allowing individuals with HIV to lead healthy and productive lives. However, access to this medication remains a challenge, particularly in resource-limited settings. So ART is good, ART is working, but the problem is who and all can access it and how much the public-private partnership will work here. Particularly, country like India, they are given free of cost from a public sector. Then what about the Americas and Africas and some of the Southeast Asian countries? Whether they are getting free of cost treatment? If they are getting, what cost? Whether they can afford it or not? These are all the challenging questions. Continued research aims to discover a cure for HIV, but until then, the focus is on improving treatment options, reducing side effects, and increasing accessibility. So that means continued research aims to discover a cure for HIV, but until then, the focus is improving treatment options, reduce side effects, increase accessibility. Presently, we don't have a cure, so use other options to manage the disease. Global initiatives such as the joint UN programs Global initiatives such as UN programs, UNAIDS play a pivotal role. That is a main role in coordinating efforts to provide a medication support, education to those affected by the virus. HIV and AIDS represent an ongoing global challenge that demands a coordinated and sustained response. That means one individual cannot do anything. Here, what coordinated effort is needed. So, journey from the identification of virus in the 1980s to the current state of medical advancement reflect the resilience of many things. One is scientific community. We know we blame scientists. They are developing drugs, they are developing chemicals, creating a problem. But the reality is, these scientific tempered people are putting their heart and soul. Then healthcare professionals. This is important. There are many healthcare professionals. Those who went to Africa, they worked with these people, developed their strategies to combat the problems, but they lost their life in the process. Then policymakers. That's also. See, the policymakers are important. They have to create a policy properly to tackle this kind of problems. How to mobilize the fund from a resource-rich nation to a resource-poor nation, because resource-poor nation sometimes may be a warehouse of particular virus, reservoir of virus. So you see now a particular virus is spreading from point one. If you want to eradicate, you have to eradicate from the point itself, because it will go into a global problem. Because these people are on continuous migrations. To truly overcome the impact of HIV and AIDS, it is essential to address the social and economic factors and spread and its spread. Ensure prevention, treatment, supportive service, and it is not accessible to only those who money. It should be accessible to everyone. Only through a comprehensive and inclusive approach can society hopefully hope to eventually eradicate this public health threat. One of the one of the strangest, the strongest public health threat. Because it's there, this challenge is there from 1980s. We could manage to eradicate some of the disease and we could manage to treat some of the disease, but it's not possible here. People are losing life. Millions of people are losing life all over the globe. That too in underdeveloped countries is more, because testing is good, not so good, data surveillance system is not so good, and treatment is also an option. If they have money, they can treat, otherwise not. I hope scientific community, healthcare professional, and policymakers join their hand together, and as a human, we are keep on evolving. We will be keep on getting a threat, but we develop strategies and medications and vaccines to eradicate one of the strongest threat what human ever faced. So in this chapter, I mean the whole HIV and AIDS, we mainly studied about uh, in the global scenario. That means how the disease started origin, then their transmissions, then how it has become a global problem from a local issue. Then what are the strategies till now we develop? What is the development of drugs and then treatment options?